Hi all, welcome to the OAAPN summary of the advisory committee. I'm Joscelyn Greaves, currently the president of the Ohio Association of Advanced Practice Nurses. Flying solo today, I don't have somebody to kind of bounce things off of, so we're gonna just cover a little bit of what the advisory committee talked about. And first I want to put a shout out to my OSANA colleagues, as they did talk a little bit about what their bill is and how hopefully it launches today. They will be having Representative Cross and Representative Wilkman introduce a bill regarding very similar to the ones that they had last General Assembly. The biggest difference is that this is not removing the physician supervision, which was the bill's plan of last time. This is going to allow them to have consultation with a physician and continue to practice in accordance to their education without removing any type of supervision, as they feel like this was kind of really what was hindering a lot of their bill progression last General Assembly. So we are totally going to be supporting them and helping them as they go through this next year or two and the passage of their bill. So we look forward to seeing that launch today and to provide that additional support. Second is I want to talk a little bit more about the acute care versus FNP, which we spent a good hour about, I think, talking as to what are they doing, what are the guidelines. OAAPN did provide comments in a document from Gina Singleton, our lawyer, and did provide her the information of our concerns. And so we did broach those and have some conversations, and some very good conversations about what those comments were. It was nice to hear them, to be able to look at them and provide their feedback and be able to hopefully use those in revising the documentation that they have. One thing that Jody did enforce is that this is a guideline. So this is not a law. This doesn't mean that it's going to be a statute. This is just a guideline, and really it's supposed to be a clarification of the article that was written about 1.5 years, 2 years ago, maybe even a little bit longer at this point, about what the scope of practice is for an acute and FNP. So this isn't make it a law. This is just what we are to use to kind of mandate what we're doing in our practices and how we are supposed to be maintaining our scope of practice. One of the challenges that we come across is practice is evolving. So what we do every day, and even with our new House bill that we have, that's going to continue to evolve our practice, and this makes it a little bit more challenging. And the guideline doesn't really attest to any of that. There is a lot of gray area, as Jody mentioned, and Jody had said, you know, look, that area, that gray area, as much as we'd like there to be a definitive line, we don't have that. And so that makes the graphs that we had on the second page, which I believe we did post on the first initial video, so if you want to go back and watch it, you can see those graphs there. That makes it even harder because we're not in that box like we talked about. We are, you know, practice has those gray shaded areas. There's kind of wavy lines that we can see. And so, in my opinion, getting rid of those graphs like they did on Broach would be great. I think it would be less confusing for people. I think that they wouldn't feel like they had to fit in that box. And so that's one thing they did discuss, and I look forward to seeing where that discussion goes. Also, there was some confusing conversation I felt about where acute care is practiced and where an FNP does practice. And one example was used as the cardiology in a heart failure clinic and how that should be in acute care. But my thought is, why couldn't that be an FNP? An FNP can manage an outpatient cardiac patient. We can treat their chronic medical conditions. It doesn't just need to be in acute care. And then does an acute care actually go into preventative medicine or into wellness? Because I don't really think they're trained that way. So then where does that line stop for them? And I don't really think they should be able to have that box go down a little bit further. That was mentioned, as Jody had said, they could go all the way down into that general wellness visits. And I'm not sure that acute care is actually trained. So again, that goes back to these graphs really should probably be taken away or revised or removed altogether, as it does make it a little bit more confusing. Sandy did bring up the opportunity for OAAPN to provide additional comments, and that was actually voted on by the advisory committee and was passed, where that next time that they come out with the next draft, we are able to review that draft and then provide comments and feedback for about a 30-minute time frame. So we are super excited about being able to have that opportunity. after we review the next draft and be able to sit down and talk with them and tell them a little bit more of our concerns and answer some of their questions and maybe even provide some legal insight from our legal team. So we do appreciate Sandy making that recommendation, and we look forward to being able to work with them on that topic. Also, I want to say, as I know a couple of them are going off of the committee, is we do appreciate their work on the advisory committee. It's hard, it's challenging, there's a lot of discussion, which is actually nice. There's good sides to both topics, and I like that they're both being able to be presented. As much as there is a lot of an acute care presence on that board, it would be nice to have a little bit more primary care presence. There's some good discussion, and so I appreciate the time that they all put into that, and I look forward to seeing who is reappointed or appointed for next session. Moving on from the advisory committee meeting, as they covered a little bit more about what we talked about Osana's bill and our bill, and then they had a great handout on CE requirements, which OAAPN will be putting out to our members as well from the Board of Nursing. So I encourage you to go to the Board of Nursing website and look at that if you have questions, and we'll get that out to our members too. But let's talk about our testimony, because tomorrow is Proponent Testimony Day. Yay! Who's excited about us? So we're going to go into the State House tomorrow. We're going to talk to and present. We're allowed 4 presenters to talk about our testimony of House Bill 177. It is at 11 o'clock, so if you are in Columbus or have the day off tomorrow and want to come down, I encourage you to be a part of that at the State House, room 17. We don't know, we don't have any control over when exactly we get to speak or how long it will take, so I do recommend that you allot a couple of hours to be able to do that, but if nothing else, continue to support us, continue to support our legislators, and provide the encouragement that they need to help with the passage of House Bill 177 and the removal of the standard care arrangement. I thank you all for watching. Please be watching your email insights for more call to actions as things come out with our House bill and moving forward with the bill progression. And we look forward to working with you in the coming months. Have a great day.